For part 4 of our Biostats series, we'll be talking about types of bias. Be sure to like and subscribe if you haven't already, and let's get right into it. To start us off, let's talk about accuracy versus precision. I'm sure you've all seen this chart on the left-hand side here, but essentially you need to know that accuracy refers to how close a measurement is to the kind of true or accepted value of a population, whereas precision refers essentially to how close the measurements of the same item are to each other. It's really high yield to know for examinations that precision is affected by random error, whereas accuracy is affected by systematic errors, such as errors in like measurement. If you have a measurement tool that's wrong every time, then your accuracy will be affected. Now let's talk about types of bias that you may see in different studies. So to start us off, we'll talk about selection bias. So selection bias occurs when you have an unrepresentative sample from the population that you want the study to apply to. So some examples of selection bias that are a little more specific include Bergson bias. This is when you take a study population or sample from a hospital. You can remember this as bedside bias for Bergson bias. They both start with a B. But you should know, that the hospitals generally have more sick individuals than would be seen in the general population, so that population might not be generalizable. Another type of selection bias is attrition bias, where a certain subset of study individuals might leave a study, leaving only the remaining participants might not be totally indicative of the population that you're interested in, especially if you're looking at a new treatment. So selection bias can be due to an unrepresentative sample, and some specific examples of selection bias that you may be tested on include Bergson bias and attrition bias. So you want to prevent selection bias with randomization, and you also don't want to be lazy. So you don't want to just grab the first 10 people you see, in the hallway and use them as your sample, because there might be this might be kind of not a representative sample. So you want to use randomization and then also get a representative sample for the population you're interested in. So for example, a study on exercise and heart disease that only includes athletes might not apply to the general population, right? Because, the athletic Olympic team is not the same as the general population. So more types of studies. Let's talk about recall bias. So these are errors in study results that are due to participants inaccurately remembering past events. In particular, this is an issue with when you use surveys, because then you're asking participants to remember what past exposures they may have had. So an example of recall bias might be that patients with lung cancer might overestimate their past smoking history compared to healthy individuals in a study, because now you're asking them, if they can recall their past smoking history, and the patient already knows that they have the outcome, which is lung cancer. So, all right, another type of bias is measurement bias. These are errors in a study that occur due to inaccurate measurement tools or techniques. A specific type of measurement bias is the Hawthorne effect, when participants change if they're being watched. And another example of measurement bias is, for example, a faulty thermometer that consistently records a lower body temperature. It can skew the study if you're using temperature as one of your metrics. To prevent measurement bias, you just want to fix your measurement tools and make sure that they are both accurate and precise. Another type of bias is procedure bias, which is a distortion in study results when one group receives different treatment than another group. So I kind of think about this as like middle child syndrome, when the middle child might get less attention, so that might kind of be a distorted study if one group receives more attention. So for example, a study comparing two drugs where one group gets frequent follow-ups while the other does not get any follow-ups might unfairly favor the more monitored group. So essentially, procedure bias is kind of playing favorites. So to prevent procedure bias, you want to use double blinding, in which neither the participant nor the observer knows what group the participant is in. All right. Now, observer expectancy bias is when a researcher's expectations influence study results. So an example of this might be a doctor that expects a new drug to work might unconsciously rate patients as improving more than they actively are. This is especially an issue if your metrics are subjective. So to prevent that, you need blinding so that the observers or the people that are obtaining the metrics don't know what group the patients are in. Now, these are a little bit more confusing. Hopefully I can explain these, but lead time bias is when earlier disease detection falsely appears to improve survival even if the disease course is unchanged. A good example of that is like pancreatic cancer. So a cancer screening test that detects tumors earlier may make survival tests seem longer even though it's not actually extending life. So if we look at the diagram here, the perceived survival time when we detect the cancer earlier, it looks like there's, all this additional gain in additional survival time, although the only thing that's really happening is the screening is improving, but the actual time of death for the patient actually is unchanged. So that's our lead time bias, right? Because we have all this additional lead time, which is what we think is improved mortality. You want to contrast that with length time bias, which is when screening disproportionately detects slow-growing, less aggressive diseases, making screening appear more effective. So length time bias will be at the end, but this will just be with less aggressive diseases, whereas lead time is in the beginning. So an example of length time bias is, let's say you have a routine mammogram that's more likely to detect slow-growing breast cancers rather than aggressive ones. So this will give the false impression that screening improves outcomes more than it actually does because you'll have additional length time bias. All right. Now this is another really high-yield concept, which is confounding. So confounding is when a third variable will distort the association between an exposure and an outcome. But the really key thing to remember with confounding is that it's associated with both the exposure and the outcome, but is not in the causal pathway. So if you look here, start off by looking at number 1, you can see that this is the typical causal pathway that we're looking for. So we have an exposure, and then it may have a mediator, and then you have an outcome. In confounding, you have an exposure, and then you see your outcome. So you think your exposure is causing the outcome, but in reality, the confounder is actually related to both the exposure and the outcome. So one example you can think of is, this is a real chart. This is a real diagram. And on the y-axis, we have number of drownings, and the x-axis, we have ice cream sales. And you can see that the drownings increase with more ice cream sales. But then you do a little bit of thinking and you realize that ice cream sales really have nothing to do with drownings, but you have a confounder, which is temperature. So when it's summer out and you have more ice cream, when it's summer out, you have more ice cream sales and more people will be going outside in the pool or swimming on the lake, and they'll also increase the number of drownings. So that will be an example of confounding. Again, it's associated with both the exposure and the outcome. All right, effect modification now. So effect modification is when a third variable changes the strength or direction of the association between an exposure and the outcome. Something that's really important to note about effect modification is it's not actually bias, but it's a real phenomenon. So it's something that you want to actually report if you do note an effect modification. So one example could be, like for a type of oral cancer, let's say there's a 2-time risk if just for alcohol and cancer alone, but if you factor in that the patient is also smoking, then it becomes, let's say, a 50-time risk. So that would be an example of smoking being an effect modifier. Another way to think about it would be kind of like an effect multiplier. So effect modification is associated only with the outcome because, alcohol is not associated with smoking directly. Now let's test out what we've learned. Question number 1. A study investigating the association between pesticide exposure and Parkinson's disease identifies 200 patients with Parkinson's and 200 without. The researchers match cases and controls by age and sex and then assess past pesticide exposure. What is the main advantage of matching in this case control study? A. Reduces recall bias. B. Increases external validity. C. controls for confounding variables, D, increases statistical power, or E, prevents selection bias. So the main thing that this question is asking is, what is the role of matching here? And the reason that we match is that we want to reduce confounding, because we want to keep key variables the same, and that includes things like age and sex. So that would be C. We are matching to control for confounding variables. Question number 2. A study examining lung cancer incidence includes only hospital inpatients. The results show a much higher incidence of lung cancer than the national averages. Which of the following best explains this discrepancy? A, measurement bias. B, selection bias. C, recall bias. Or D, lead time bias. So we have a study examining lung cancer incidence that is only looking at hospital inpatients. So do you guys remember what type of bias this is? That's right, this is Berkson bias, which you can also remember as bedside bias. So what type of bias is Berkson bias? That will be a type of selection bias, which is B. A case control study investigates the association between pesticide exposure and Parkinson's disease. Patients with Parkinson's are more likely to report past exposure than the controls. What type of bias does this illustrate? A, information bias. B, recall bias. C, selection bias. Or D, lead time bias. So here we have a case control study, and they're essentially sending out a survey in which patients can report past exposures. So this is very prone to recall bias. Remember, this is a common type of bias you should think about when we use surveys. So that would be B, recall bias. Question number 4. A clinical trial compares outcomes of 2 surgical techniques, but patients undergoing the newer technique receive more frequent post-op checks. What type of bias does this create? A, measurement bias. B, procedure bias. C, observer bias. Or D, selection bias. So here we have a clinical trial that's comparing surgical techniques, but we have a bias that's formed because one group is receiving more frequent post-op checks. Remember, this is our middle child syndrome, or we can also think of it as one group receiving preferential treatment. So preferential is procedure bias. So B, procedure bias, is the correct answer. Question number 5. A researcher consistently uses a faulty blood pressure cuff that overestimates systolic blood pressure in all participants. What type of bias results? A, confounding. B, measurement bias. C, recall bias. Or D, selection bias. So here we have a faulty blood pressure cuff. So this would be a measurement tool that is causing a faulty blood pressure reading. So when we have a faulty measurement tool, that's a type of measurement bias, which is B. Question number 6. A new cancer screening test detects cancer earlier than current methods, but does not change overall survival. What type of bias may this create in outcome interpretation? A, selection bias. B, lead time bias. C, length time bias. Or D, observer bias. So here we have a test that is detecting cancer earlier but not changing overall survival. So you want to be looking out for a certain type of bias, right? So let's say with the new test, we are detecting cancer at this point, and then survival is here. Whereas with the old test, we're detecting here. Oh my goodness. The spelling's is a little bit off today. The shot's not falling. There we go. Detect, but the mortality is the same. So the overall survival has not changed. What is this period called? That is our lead time. So this would be a lead time bias, which is answer B. Question number 7. A screening test detects slow-growing cancers more often than aggressive ones. Patients diagnosed through screening appear to live longer even though prognosis is unchanged. This is an example of A. Lead time bias, B. Measurement bias, C. Length time bias, or D. Confounding. So here we have a screening test that's more likely to detect slow-growing cancers, and then patients who are detected through the screening appear to live longer even though the prognosis is unchanged. So this is our classic definition of C, length time bias. Question number 8. A study finds that coffee drinkers have higher rates of pancreatic cancer. However, it is later found that coffee drinkers in this study were more likely to smoke. What does this scenario illustrate? A. Recall bias, B. Confounding, C. Effect modification, or D. Lead time bias. So here in this question we have coffee drinkers they think have higher rates of pancreatic cancer, although it seems more likely that the coffee drinkers are related to smoking, and then the smoking is more related to pancreatic cancer. So here we have our exposure, which we think is causing cancer, the exposure being coffee. But in reality, our exposure coffee, so coffee drinks are more likely to smoke, and smoking is more likely to cause pancreatic cancer. So this would be an example of confounding, since it's related to both the exposure and the outcome. Question number 9. A study evaluates the effect of a drug on stroke prevention. Results show the drug significantly reduces stroke in patients over 65, but not in younger patients. Which concept best explains this? A. Confounding, B. Selection bias, C. Effect modification, or D. Measurement bias. So here we have a study that is looking at the effect of a drug on stroke prevention, but really this drug is just significantly reducing stroke in patients over age 65. So here we have a exposure and then an outcome. But it seems that the outcome is affected by another variable, which is age. So this would be an example of an effect modifier, because the effect modifier is only affecting the outcome, which is stroke. So this would be C, effect modification. Question number 10. In a study where physicians know which patients receive treatment, they rate these patients' symptoms as less severe. What bias is most likely present? A. Measurement bias, B. Observer bias, C. Selection bias, or D. Recall bias. So in this case, we have physicians that are not blinded, so they know which patients receive treatment, and there seems to be bias as they're more likely to rate these patients as less severe. So in this case, physicians are the observer who are grading the study. So this would be a type of observer bias, which is B. Question 11. A longitudinal study on depression loses 30% of participants before completion, mostly those with worsening symptoms. What type of bias does this cause? A. Procedure bias, B. Measurement bias, C. Attrition bias, or D. Length time bias. So here we have a study in which 30% of participants are lost to follow-up before completion. So this is a classic example of C, attrition bias, which is a type of, what type of bias? Selection bias. So sometimes in the question they might also just use selection bias in the answers, and you need to know that attrition bias is one form of selection bias. Our last question, question number 12. Which of the following is the best way to minimize measurement bias in a clinical trial? A. Use historical controls. B. Blinding of outcome assessors. C. Increase sample size. Or D. Use subjective endpoints. So the best way to minimize measurement bias is to have good tools that are well validated, and 2 is to have blinding of the observer and the outcome assessors. So this would be B, blinding of outcome assessors, which would be your observers. All right, everyone. Thanks for watching, and Make sure to like, comment, subscribe, and share if you found this helpful, and we'll see you in the next one. Peace.